Good morning, everybody, and welcome. My name is Angeline Webb, and I'm pleased to be your MC today. I'm the president of the Alberta Public Health Association, and I'm joining you today in that role alongside our partners at the Public Health Agency of Canada and the O'Brien Institute for Public Health at the University of Calgary. Thank you for taking the time to be with us for this important conversation. Before we begin, I would like to acknowledge the land we are on. The University of Calgary, located in the heart of southern Alberta, both acknowledges and pays tribute to the traditional territories of the peoples of Treaty 7, which include the Tsuut'ina First Nation and the Stoney Nakoda, including the Chiniki, Bearspaw, and Goodstoney First Nations, as well as the Blackfoot Confederacy, comprised of the Siksika, Piikani, and Kainai First Nations. The City of Calgary is also home to the Métis Nation of Alberta, including the Nose Hill Métis District 5 and the Elbow Métis District 6. As we discuss public health systems, equity, and collaboration today, we do so with respect for Indigenous knowledge systems and governance, and with ongoing commitment to reconciliation. Today's webinar, Realizing the Future of Vaccination for Public Health, features the 2024 Chief Public Health Officer of Canada's report on the state of public health in Canada. The report offers forward-looking vision for how Canada can realize the full potential of vaccination across the life course. It highlights the need for sustainable investment, stronger data and evidence systems, and deeper collaboration across jurisdictions, communities, and sectors, including First Nations, Inuit, and Métis governance. This session is also the first webinar in the four-part Immunization in Alberta series presented by the Public Health Agency of Canada, the O'Brien Institute for Public Health, and the Alberta Public Health Association. Over the series, we'll be highlighting best practices, equity considerations, and opportunities to strengthen vaccine advocacy and policy across healthcare and public health. We will have a Q&A period following the presentation, so we invite you to type your questions out, and time permitting, we will get to as many as possible. The Q&A section can be accessed from the feature menu usually at the bottom of your screen. Click on Q&A, type your question, and then enter submit. Before we move into the presentations, a couple quick participation notes. I'm going to launch one short poll now asking about your professional affiliation. This helps us understand who's in the room today. At the end of the webinar, we'll also share a brief event survey. Your feedback is extremely valuable and helps us shape future sessions in this series. Thank you in advance for taking a moment to complete both. Okay. Thank you, everybody. I'd like to I'm pleased now to introduce today's speakers. I'll briefly introduce each of them, and then we'll move into the presentations. First of all, Martin Donner is a manager with the Immunization Partnership Fund at the Public Health Agency of Canada. He brings extensive experience in grants and contributions programming and works closely with national, regional, and community-based partners to support initiatives that improve access to, confidence in, and uptake of vaccines across Canada. Madison Fullerton is the Vice President of Operations and Community Partnerships at Praxis Health and a PhD candidate in medical sciences at the University of Calgary. With over a decade of experience in health promotion, her work focuses on improving access to preventative care, including supported families new to Canada and accessing routine childhood immunizations. Deirdre Lake has a background in education and has specialized in language and workplace competency-based assessment. She has led numerous programs and research initiatives for nonprofit organizations and large institutions, and has served on several provincial and national advisory committees, including the Government of Alberta. Her work includes research related to language assessment and internationally trained professionals. Sarah Maxwell is a senior science policy analyst in the Office of the Chief Public Health Officer at the Public Health Agency of Canada. She advises on strategic policy opportunities, knowledge translation, and the development of the CPHO reports. Over her time at the Public Health Agency of Canada, she has led leadership roles across vaccination policy, biomanufacturing, and grants and contributions, overseeing more than $80 million in public health funding. Thank you to all of our speakers for joining us today and for sharing your expertise. We will now start today's sessions with these short presentations. Thank you.
Hi, everybody. Can everybody hear me? Sounds good. All right, as mentioned, my name is Martin Dorner, and I am the manager for the Immunization Partnership Fund in Public Health Agency in Ottawa. I'm located in Ottawa, and it's very nice to be part of this presentation. Okay, next slide, please. So the Immunization Partnership Fund, or we call it IPF, is a grant and contribution program that supports public health stakeholders, trusted partners, and communities across Canada to increase vaccine acceptance and uptake. It is the only GSNC program of its kind in Canada. It was first established in 2016, and we have provided the funding to various organizations. I think as of right now, it's close to 300 organizations from 2016 all the way up to today. The IPF provides funding to local, regional, and national organizations to develop and implement community-centered, equity-based, evidence-informed, and culture-safe initiatives that aim to promote education and build awareness of the importance of vaccination across the life course. Life course meaning from early childhood all the way to late adulthood. IPF also fund initiatives that build on vaccine literacy, strengthen vaccine confidence and uptake, and combat vaccine-related mis- and disinformation, and reduce socio, cultural, and physical barriers to vaccination, particularly among population experiencing or facing the systematic or structural inequalities. As you can see on the right part of the slide, some of these priority populations are Black Canadians, Indigenous people, racialized communities, marginalized groups, linguistic or religious minority group, QSL, LGBTQIA+ individuals, people with disabilities and chronic illnesses, those facing housing insecurities, and really mostly the individuals who have a lack of accessing the vaccinations. IPF objectives have ebbed and flowed a little over the years, but largely remain the same, and as they have been right now. Funding recipients must usually meet one of these two objectives. The first objective is to develop and implement community-centered vaccination, education, promotion, or outreach activities that aim to improve vaccine hesitancy and vaccine confidence. And the second objective is to build the capacity of healthcare services providers, so really the healthcare providers. Next slide, please. On this slide, you can see a current program design of IPF, or Immunization Partnership Fund, which I want to share to help everyone appreciate how the IPF goes about trying to meet its goals. As I mentioned, we have two objectives: the community-centered vaccination, education, promotion, and outreach, and build of the capacity of healthcare providers. The IPF core program principles, which drive all interventions, and these principles require funding project to be culturally safe, equity promoting, and evidence informed. You can also see our audience, as mentioned before, priority population, and IPF recipients are required to have their involvement in one of the IPF priority population, which I mentioned on the previous slide. IPF sets itself apart as exemplified in these methods, and can be seen in the fourth box. All of the interventions are highly tailored to meet the needs of each community or group, with focus on building and maintaining trust among primary among the priority population who have experienced historical and present-day mistreatment in the healthcare system. Together, this all allows IPF intervention to enable increased vaccine confidence and uptake among priority population across the life course to prevent the spread of vaccine-preventable diseases. Next slide, please. So in the current cohort of recipients from 2024 until end of this fiscal year, which is March 31st, 2026, we fund 38 funding recipients from coast to coast, and the funding is about $10 million over 2 years. The goal of the IPF for current round of funding is to increase vaccine confidence and uptake in Canada among priority populations, as mentioned before across the life course. We do this by supporting community-driven initiatives that helps to close the gap among population with lower vaccine uptake. And on the right-hand side, I just want to share with you some of our successes and some of the numbers. Since 2016, we have invested well over $100 million in vaccine confidence, access, and uptake, established more than 200 contribution agreements with more than 140 recipients, created close to 8,000 funding opportunities, and close to 400,000 individuals were vaccinated, as well as through our funding recipients have developed quite a few of the online resources, which were accessed close to 12 million times, and close to 10,000 various resources were developed by the funding recipients. And on the next slide, I just want to share again, I'm not going to go through this, but it's really our infographic that explains really in more details and graphical design what the Immunization Partnership Fund, our goals, who our priority populations are, our investments, and who the priority populations and who we support. So this is it for IPF. If there are any questions or comments, I can either take them now or we can wait after all the presentations are completed.
Thank you, Martin, very much. We'll take Q&A at the end of all the presentations. I'd like to indicate that Sarah Maxwell is no longer able to join us, and in her place, we welcome Jen Liu. So Jen, I think you're good to go.
There we go. Thanks for your patience, everyone. Just slight change of plans due to some logistical issues. Sarah Maxwell regrets not being able. I'm filling in. I am the acting director in the Office of the Chief Public Health Officer. I'm part of the team that developed this 2024 report on realizing the future of vaccination for public health. I'm calling in from the traditional unceded and unsurrendered territory of the Anishinaabe Algonquin people, and I'm happy to give you an overview of the report in Sarah's absence. Next slide, please. So for context, every year the CPHO is mandated to provide a report to the Minister of Health that examines the state of public health in Canada. Since 2021, the suite of CPHO reports have focused on the theme of transforming our public health system. So the 2024 report continued that focus, specifically looking at how we can strengthen the public health system so that everyone in Canada can fully benefit from vaccination throughout their lives. The 2024 report also was accompanied by a companion resource released in June 2025, drafted by the Office of the Chief Science Officer at the agency, and that outlined research priorities to support the vision and objectives of the report. Next slide, please. There are several complex factors that highlight the importance of a strong vaccination system, such as climate change, which drives changes in disease patterns, gaps in vaccine coverage, a polarized information environment, and barriers to access for vaccination resources and services. The COVID-19 pandemic notably advanced vaccine technology and evidence, We now have a growing vaccine pipeline, which presents both opportunities and challenges. These vaccines offer the ability to tackle a wide range of public health issues, from cancers to chronic disease, and enhance vaccination practices. For instance, we're seeing innovations like nasal vaccines and microneedle patches, which could improve the vaccination experience for both vaccinators and patients. We've learned many valuable lessons from our responses to COVID-19, as well as the 2022 mpox outbreak. We've learned that we need to remain vigilant and prepare for future pandemics by adapting our approaches and incorporating our lessons learned. Another intention of this report was to inform ongoing policy efforts, such as the renewal of the National Immunization Strategy, or to advance the WHO pandemic agreements. Next slide, please. Vaccination is a fundamental pillar of public health. Over the past 50 years, vaccines are estimated to have saved 154 million lives. The benefits of vaccines go beyond reducing the impact of infectious diseases. Vaccination also contributes to long-term overall health and well-being. For example, the HPV vaccine helps protect against cervical and other cancers, and COVID-19 vaccination is associated with a lower risk of developing post-COVID-19 conditions. By reducing the overall burden of infectious diseases, vaccination provides significant returns on investment. It decreases healthcare system burdens, boosts productivity, and reduces the economic burden of disease outbreaks. Equity-focused and evidence-based vaccination programs can further improve population health and strengthen connections to healthcare systems by providing earlier connection to healthcare providers. Next slide, please. Our hope is that this report would drive action across the public health system to harness the full potential of vaccination for improving population health. In writing this report, we gathered lessons from the COVID-19 pandemic and other public health emergencies. These insights can inform future research, policy development, and community-focused programming efforts. The report was also aimed to provide evidence-based recommendations to support equitable and sustainable vaccination decision-making. While the primary audience is decision makers at all levels of government, insights and actions outlined in the report are relevant to many different players in the vaccination system. Next slide, please. This 2024 report put forward a vision for the future in which everyone in Canada can experience the benefits of vaccination for health and well-being across their lives. To achieve this, we need to prioritize equitable access to vaccination. This requires efficient collaboration between public health systems and communities, as well as fostering innovation to build a system that can adapt to future needs and contexts. The report is structured around a framework from the 2021 CPHO report on public health system transformation. You'll notice that these public health building blocks on the outer edges of this figure, which represent how public health systems are organized. On the left, we have the tools of the public health system. These include policy and program interventions, evidence, knowledge and information, and medical and digital health technology. On the right, we see the foundational building blocks of workforce expertise and human resources capacity, financing, governance, leadership, and engagement. These building blocks organize the report and provide clear entry points for system-level actions. Additionally, overarching principles like equity, which are found in the outer ring of the middle circle, are integrated throughout the report. Next slide, please. We've included applied public health examples throughout the report to drive the narrative and exemplify research in action. Multiple examples from Alberta are cited, including culturally safe COVID-19 vaccine clinics led by Nation Alberta, the AIMGA's work in COVID-19 clinics and vaccination tools and health system partnerships, the Enhancing HPV Vaccination and First Nations in Alberta project, a joint effort between the University of Calgary researchers, First Nations from 6 partnered communities, and the Alberta First Nations Information Governance Centre to use community-centered data collection to understand barriers and facilitators of HPV vaccine uptake in the First Nations communities. and as well the success of Calgary school-based vaccination systems in mitigating differences in HPV vaccine coverage that are rooted in socioeconomic inequities. Next slide, please. Each report wraps up with a way forward section that offers tangible recommendations for system-level action. In this report, the way forward outlines tangible actions designed to drive progress in several key areas, such as guiding sustainable investments in vaccination, strengthening vaccination data and evidence systems, and expanding collaboration mechanisms within the vaccine system. More specifically, sustainable investments. Decision makers often face challenges with resource constraints, competing priorities, and limited public health budgets when preparing for publicly funded programs and new vaccines. Strengthen data and evidence. For vaccination programs and policies to be effective, we need data and evidence that is timely, comprehensive, relevant, and accessible to both decision makers and communities. And then with respect to collaboration, the vaccination and population health landscapes change and evolve. So how we can, it sort of describes how we must work together to also address those changes as well. Next slide, please. Decision makers often face challenges with resource constraints, competing priorities, and limited public health budgets when planning for programs. As we've said, the report states that it's crucial to invest in public health infrastructure for vaccine delivery. This includes funding the public health workforce and ensuring that we have the necessary resources and infrastructure to do their jobs effectively. It also emphasizes the need to explore opportunities to involve a diverse range of health and non-health professions, such as community health workers, to support vaccination efforts. Further, it recommends allocating funding and resource towards evaluating vaccine programs as a whole. This is going to help better understand and forecast the economic, social, and health impacts of vaccination and make informed decisions to improve vaccination programs and allocate resources. Additionally, it states that sufficient and consistent funding is essential to tailor vaccination approaches for populations not well served by traditional public health approaches. So that includes targeted resources for Indigenous communities. Next slide, please. For vaccination programs and policies to be effective, we need data and evidence that is timely, comprehensive, and relevant. As the landscapes change, our evidence systems must evolve as well. Despite ongoing efforts, there's still challenges with making vaccine registries and other health system data interoperable. As such, the report called for FPT governments to honor existing commitments to modernize Canada's data, public health surveillance systems, so that we can better understand what's driving vaccine uptake and take those steps, specific targeted steps to improve. The report, as well as the Research Priorities Companion document, also calls for us to incentivize new research and technological innovations and advanced tools for data collection and analysis. This entails strengthening linkages between research and surveillance programs, decision makers, and the communities they serve. It also involves developing and validating methods and indicators to measure vaccine access, acceptance, knowledge, attitudes, and beliefs. Additionally, the report highlights the need for community-informed data to address local priorities effectively. As such, it recommends integrating community knowledge while respecting data sovereignty principles, as well as establishing mechanisms that support community-driven research. Slide 11. Or next slide. You might have different. The basis for the third way forward bucket is that collaboration is essential for harnessing expertise across the entire vaccination system. Canada's federated system allows each jurisdiction to tailor its vaccination programs to local needs. However, smaller jurisdictions may be limited in their capacity to evaluate programs or forecast future demands. Consequently, the report highlights that value of sharing knowledge and skills across jurisdictions and sectors to help optimize vaccination efforts and support self-determination. Collaboration can extend to communication strategies aimed at improving digital health literacy, building public trust in science, and dispelling vaccine mis and disinformation. Another way forward item is the need for clear and effective mechanisms for intersectoral collaboration. This will ensure public health analyses inform vaccine research and development decisions, strengthening the vaccine pipeline to better meet community needs across Canada. Additionally, it's important to ensure proper representation in vaccine governance systems, further building robust collaboration mechanisms supported by long-term funding will help maintain relationships and community leaders and organizations, making community engagement a fundamental component of the vaccination system. Finally, the report states that Canada can continue to be a leader in global health security through sustained international partnerships focused on shared challenges. Next slide, please. It's been almost a year and a half since the report was released. In that time, we've released the report companion, as mentioned earlier. The policy landscape, the interim 2025-2030 National Immunization Strategy was also released last summer. The strategy cites best practices as published in the CPHO report and builds on many of the way forward recommendations. This summer, we saw the conclusion of Dr. Theresa Tam as CPHO, the conclusion of her term as CPHO. Before she left, she was able to influence and sign off on her final report under the for the 2025 CPHO annual report named Working Together to Thrive Wellbeing in Public Health. And this report explores the potential of wellbeing across approaches across public health. While well-being and vaccination are distinct topics, similar themes were continued throughout, such as the importance of health equity, social and structural determinants, Indigenous self-determination, and intersectoral action and partnerships. I urge you to check out the Public Health Agency website for the whole suite of reports. And should you have further questions, you can reach out to me or Sarah, whose email address should appear on that next slide. I think I forgot to say next slide. I'm sorry to the operator.
Wonderful. Thank you so much, Jen. Now we're have Madison is up next. Over to you, Madison.
Awesome. Thank you so much. Hi, everyone. Really excited to be here today sharing some of the work that we've been able to do through the IPF Fund over the past few years. Next slide, please. So for those of you who don't know who we are, Praxis Health, formerly known as 19 to 0, we're a Canadian not-for-profit. Ultimately, we try to understand why people do what they do related to their health behaviors and work with communities and a wide range of partners to really support healthier behaviors. This spans across a wide range of health topics, but we do a lot of work in the immunization space. And so we've been really fortunate to partner with IPF for about 3 years now and a couple of grants to really build out a portfolio of work to support newcomers. So immigrants, refugees with navigating routine childhood immunizations, school-based vaccination programs, and naturally supporting adult newcomers as well with adult immunizations. And so excited to share today a bit about the insights that we've gathered and how we're working with communities to share that information. So on the next slide. Awesome. So I won't present too much on some of the research that we've done, but I just wanted to highlight that over the past few years, we've done a variety of mixed methods projects trying to understand the barriers and facilitators for accessing routine childhood immunizations here in Canada and specifically in Alberta. And so most recently, we conducted 11 focus groups with over 80 participants. We really wanted to make sure that we had representation from individuals from a wide range of countries. So we did have individuals from 13 different countries of origin, also representing multiple first languages as well. The work that we did was done in first languages. So whenever possible, we tried to do interviews and focus groups with an individual who's, a trusted voice from the communities that we're engaging with. So a first language qualitative researcher. So just really quickly, some of the themes, we just kind of put a quick word map up here just to highlight some of the one-liners for some of the themes that we've been hearing. So maybe no surprises in this, era of vaccine misinformation, but hearing a lot around newcomers facing barriers with navigation. So recognizing that immunization schedules are different country to country, but also even province to province sometimes. And so navigating vaccine schedules being a large barrier, communication and trust, especially in light of the pandemic, where do you go for health information? Who do you trust for information about vaccinations? And, are those sources that you're turning to, reliable? Are they, culturally appropriate, translated, and available in multiple languages? So we really wanted to work with our partners to understand how could we move some of these themes that we've been hearing into action. And so this involved two things. The first was developing a toolkit of tailored educational resources that addressed some of the barriers and facilitators that we were hearing from parents. And then the second part was to work hand in hand with newcomer service providing organizations in Alberta to actually mobilize that toolkit into community. So if we go to the next slide. Over the past few years, we were able to use our insights and learnings from our partners, and we had members from different newcomer communities participate in a few different co-design workshops to actually develop a suite of tailored resources. So what you can see here on the screen are two examples of some of our school-based resources. These were message tested with newcomer parents. And we've gone through, I don't know, probably 5 different iterations of these resources now, but really wanted to make sure that they addressed the key questions and concerns we were hearing from parents. And so some of our early work with IPF, we were able to work with the Calgary Board of Education to actually mobilize these resources into schools in Calgary. We've been able to partner with different health authorities across the country to co-brand these to really get them shared through public health nurses and in schools. And so we have these resources available in over 12 different languages, and we do have them by province for each of the vaccines that are offered in school-based programs. So based on the resources that we developed, we then wanted to work really closely with our community partners to share them. And so we conducted a bit of an environmental scan. We learned from, best practices around how can we actually engage underserved communities, specifically newcomers, in vaccine information. And collectively, we decided to move forward with a community health ambassador model. So on the next slide. Awesome. So we decided that we wanted to use community health ambassadors to share this information in communities. So really quickly, health ambassadors can be defined as trusted voices who understand the culture, needs, and priorities of their community. Ultimately, they are experts in their community first, and we can train them to educate and provide one-on-one engagement on a wide range of health topics. But globally, this model has been shown to be really effective at supporting conversations around immunizations to support informed decision-making and ultimately increasing vaccine confidence. So on the next slide, these are some of the ways that we can partner with health ambassadors. So one is, health ambassadors are able to connect directly in the community. So because they're an expert in the community, they know where to reach people, and which I'm going to show in a couple of slides. Tailored communication, so they're able to take, for example, those resources and other resources and communicate it in a way that's culturally appropriate for the different groups that they engage with. They can also support health system navigation. So actually connecting people in with health services. So maybe it's booking a vaccine appointment, which I think Deidre is going to present a bit on, or even service delivery. So in some cases, they can actually provide health services directly out in community. So next slide. Awesome. Okay, so with that being said, what we did last fall is we identified 10 community health ambassadors, specifically looking for people with lived experience as a newcomer in Canada. We specifically wanted to find people who were a volunteer or employee of a partnering newcomer organization. So the Calgary, now Canadian Immigrant Women's Association and the Calgary Catholic Immigration Society, as well as AIMGA, were some of our key partners in terms of identifying people to participate in these roles. And we wanted to make sure they were fluent in a wide range of first languages. Last fall, we trained the health ambassadors through a series of 4 workshops. We worked really closely with Health Commons Solutions Lab out in Ontario, who has built out a really robust community health ambassador program. And after the training, we launched the health ambassadors in community. And so we did a couple of sessions at the end of 2024 to warm them up so they could practice their skills. And then we launched about a year ago. And so on the next slide, you can see what that's looked like. So we are very proud of the community health ambassadors. We've been able to reach over 3,500 newcomers. So this is either through one-on-one conversations or small group presentations. So sometimes this looks like partnering with, as I mentioned, those newcomer service providing organizations to leverage English language classes, temporary foreign worker programs. Sometimes it actually looks like going out into the community and engaging with people at community associations, sports, rec, libraries. We've actually had a lot of success going through faith-based communities. So some of our health ambassadors, it was really important to them to reach people through bazaars and mosques. And so we've really left it up to them to navigate and point us in the direction in terms of where the best places are to reach people. And so with that, we'll move to the next slide. So just wanted to really quickly share a couple of key learnings from some of this work. So can't emphasize enough the importance of engaging community partners early in the process, as it can lead to important implementation considerations. Maybe this goes without saying, but I think all the way from collecting those insights to co-designing, interventions to launching them, and even through to evaluation, the importance of making sure that's done in a true co-design process where you are working hand in hand with community and partners to make sure that we are co-designing realistic initiatives that truly have the possibility to be sustained long-term. That leads me into the second point around utilizing pre-existing and trusted information channels to disseminate immunization information. It was really important to us to leverage existing roles within our partnering organization so that we could ensure some level of sustainability beyond. So the health ambassadors, a lot of the times, were either currently volunteering as medical translators. So we really wanted to make sure that even once, grant funding ended, that we were building champions internally at these organizations that could continue to support vaccine conversations on a daily basis. I think this is really important to highlight because newcomer service providing organizations actually don't receive funding to support health navigation. And so for newcomers who are processed through one of these resettlement organizations, they actually, a lot of the times, are supported for up to 2 years by these organizations. And so for a lot of the times, they end up being a trusted source of information for about 2 years. And so I think it really speaks to the importance of, opportunities like the IPF to support sustainability and actually build capacity for organizations to work in a way that they aren't normally funded to. And then the last one is translating not just the content, but also important contextual considerations. We heard a lot of the times that people will, use Google Translate feature to translate a web page. And yes, it might literally translate word for word, but there's a lot of important contextual considerations that are missing. And with some community groups, this actually has the potential to turn people off from getting vaccinated. And so we really noticed a difference between how we engaged the Eritrean community versus Filipino community. And so I think it speaks to, again, the importance of making sure that we're taking those different cultural considerations into account very, very early on. So thank you. I think that's everything.
Thank you very much, Madison. Appreciate that. Just a reminder for folks to submit your questions via the Q&A function. Now over to Deirdre for your presentation.
All right. Thank you so much. I'm really pleased to be here on behalf of our initiative and to share our lessons learned with you. And some of those might be similar to what Madison just shared. But I know I have 10 minutes, and I just did want to take a few minutes to introduce who we are and our initiative. So the next slide, please. Just Thank you. So AIMGA is also known as the ITP Hub, and we're a not-for-profit organization dedicated to supporting internationally trained physicians as they navigate pathways to licensure and employment in healthcare. So we have over 3,500 active members across the country, with approximately 1,200 residing in Alberta. Our membership expands across a wide range of disciplines, with over 60 having a background in public health, for example. So I'll just, next slide, thank you. So when I started my role here at the organization, which was in 2018, I was looking at the talent pool that we have and asked myself, how might we utilize the skills and the knowledge of our membership to provide opportunities and experiences in community that might lead to employment or provide an introduction into primary care where physicians are needed, and of course where they were looking to become licensed. So this work was done in consultation with Dr. Turin and Nishit Chowdhury at U of C, and we identified various roles such as community researchers, interpreters, navigators, and community champions in the area of health promotion. Next slide. So, of course, then the pandemic happened. AHS called upon us when the outbreaks occurred in the meatpacking plants, and what was needed were multilingual health professionals. So this led to working with CDC and providing interpretation for AHS at workplaces and online town halls. We translated public health information into short video clips and produced resources in over 19 languages, and our volunteers became familiar faces and voices of comfort during these times. And our members were hired as contact tracers, and some of those individuals are now in residency programs or in practice. We obtained funding for to support our efforts in community, and since then we've been building upon the lessons that we've learned to continue to address vaccine hesitancy and uptake. So next slide. So our goals have remained consistent, and that is to address vaccine hesitancy, provide newcomers with the information that they need to make informed decisions, increase uptake in Calgary, and finally to provide the supports needed on the ground to get vaccines in arms. And so our approach has been threefold. It's community engagement through outreach, enabling us to build and maintain trust, health presentations in clear language and in multiple languages to increase knowledge about vaccines and empower newcomer families to make informed decisions. And lastly, by providing navigation supports, we directly reduce barriers to access. We make phone calls, we book appointments, we accompany patients to and from appointments where we provide in-person interpretation. And so this approach utilizes the skills and knowledge of our members to support newcomer communities in Alberta and access health through providing information, interpretation, and navigation services. Next slide. So I just wanted to highlight the many enduring partnerships that we have maintained and established throughout our work. And so these are our core partners. I wanted to give them a shout out. So next slide. So one thing that makes our project unique, of course, is the utilization of IMGs who are trusted members within their communities. And then the training that our navigators receive, it's a 16-week training program. It's our patient navigation program, which focuses on understanding the health system, getting certified in the areas of patient navigation and interpretation, and of course, health education and community engagement. Next slide. So in terms of, our typical clients are newcomers and newly arrived refugees who face various social determinants of health. Some have little to no literacy in English and in some cases their own language. So I'd just like to share a quick few stories. So a newly arrived father of 3 from Syria wanted to book his children's vaccines, but every time he dialed 811, he was met with a recorded message and a long wait on hold. So his prepaid pay-as-you-go phone meant sacrificing credit that he needed to call home. So he simply hung up. He tried to use the AHS website only to discover he needed a provincial health number, reliable internet connection, and needed to upload vaccine records through an online portal. And at the time, he didn't have a computer. So, this wasn't an isolated case, but I think it speaks to sometimes the wait times can be lengthy. And to address this, we were able to work in partnership to obtain permissions from AHS to book multiple appointments for community members and upload vaccine records on their behalf to support the process for both patients and providers. With regards to language barriers, a story about an Afghan family newly arrived in Canada seeking vaccinations again for their children. On the day of their appointment, our navigator accompanied them on public transit to the clinic and provided interpretation. The father became uneasy when he asked for consent multiple times, and so something that was unfamiliar to him. So he began actually questioning the competence of the providers at the clinic and the reliability of the process and the vaccines. So he had requested to leave, and this is where our navigator played a crucial role, explaining why consent is a key part of care in Canada, and was able to provide the cultural bridge needed to maintain trust. So not only was the family reassured and agreed to proceed, but this also sparked an important conversation within our team about how routine practices like consent can be misunderstood by newcomer families and how we might be able to facilitate understanding of cultural differences across systems. And so I think these stories show why our work matters, and it's more than translation. It's about building equity, trust, and shared understanding on both sides. And it shows the transformative role that our members can play as trusted community voices and system navigators. Next slide, please. So in terms of lessons learned, again, we learned that trust simply isn't granted by a single campaign. It's earned over time through tangible support and a reliable and consistent presence. We learned that showing up where newcomers already gather, whether at immigrant serving organizations, ESL classes, or weekend community events, and adapting to their schedules, so including evenings and weekends, signaled a genuine commitment to community partners. And pairing this visibility with practical navigation assistance, so scheduling appointments, navigating transit, following up, demonstrated that we prioritize their well-being over messaging or just simply information. So engaging respected community figures further validated our efforts. And the key takeaway for us was that investing in consistent, locally embedded relationships yields far greater trust than just one-off sort of outreach. Secondly, knowledge transfer, passing along information is not enough. Materials, I think Madison had spoke to this really well, that materials must be understandable, culturally resonant and delivered in formats that match people's abilities. So we learned that pre-testing plain language, having our community members give input on the multilingual resources that we were developing and refining them based on feedback helped to produce both clarity and buy-in. Combining printed information with short mobile-friendly videos, which we did, ensured that we reached everyone regardless of their literacy or digital access levels. And then combating, misinformation. Our experience has showed that, facilitated conversations led by trusted messengers who openly discuss, deep-rooted myths, the benefits and risks to vaccination, really help to create safe spaces for questions and build credibility. Techniques like active listening and motivational interviewing, which our members were trained in, allowed our team to uncover specific concerns and address them directly. And then, of course, framing messages to align with cultural values. So, for example, presenting a flu vaccine as a means to protect your children and elders, resonated more powerfully than, clinical or factual language. And then I think, addressing, biases at times, our navigators who shared cultural and linguistic backgrounds with patients, often encountered some skepticism or dismissiveness from some healthcare staff. So in one case, for example, a specialist stated that they didn't think interpretation was needed, which was dismissive to the patient's wishes and the navigator who was there to act as a bridge between the physician and the patient. So, we took these examples and these experiences, and this taught us that, not only promoting our services within community was enough, but to promote our services and the navigators and the role of our navigators with systems as well, to help transform, any negative experiences into opportunities and to build genuine trust and partnerships. And so, just recognizing that equity is foundational to effective public health engagement. Next slide. I think I'm actually at time. So I think some of these things will come up in the discussion that happens. I'll just ask you to go to the next slide. So in terms of future directions, just, expanding upon cultural appropriate navigation supports, again, I think that navigation supports allowed people to take action. And so advocating for policy changes that support, integration of who we serve, our internationally trained doctors, to be able to support and provide, within the public health domain. And then, sort of replicating that sociocultural clinical model was something that has certainly, been raised with regards to promoting equitable healthcare for marginalized communities, and then, of course, promoting diversity in healthcare. So I will leave it at that and open it up over to you, Angeline.
Great. Thank you so much, Deirdre. Now we just have a few minutes left, about 6 minutes. So we just have time for a couple of questions, and this is to all of our presenters. The first question is, with the state of US public health system turning towards less evidence-focused vaccination policy, are there changes you've seen within Canada and Alberta? This is to all the presenters.
I think definitely we've had questions, within our community conversations, just looking at what's happening in the South, just more or less concerns expressed, by different community leaders and in those community conversations that we've had.
Thank you, Deirdre. Any other comment from our other presenters, Madison, Martin, Jen? No? Okay. This is for Madison. Quick questions just with reference to some of your resources. They would like to know how do they get pamphlets that you showed on HPV and MC, etc., with the different languages from Praxis. So would that be on your website? And
Yes, we do have it on the website, but I'm also happy in the chat to share the link directly. With that being said, if anyone has additional languages that they would like the resources translated into, please let us know. We have IPF for a couple more months, so we still have some budget left over to do some additional translations. So please reach out if we can tailor them for you in any way.
Great, thank you. And this is also for all the presenters. This is just bit more Alberta focused. As part of the Minister of Primary and Preventative Health Services' most recent mandate letter, the Alberta government indicated that a review of government vaccine policy will take place. The focus of the review is ensuring that vaccinations paid for by government are targeted to population groups that are scientifically proven to be at substantial risk of adverse health outcomes should they remain unvaccinated, as well as assessing whether there is value in funding additional vaccinations not yet funded by government for certain at-risk groups. For the presenters, what would be your top recommendation to improve equitable access to vaccination and uptake if you were to provide a submission for this review? That's a big question.
I know for us, just in short, it was increasing the navigation supports. So I think there's, and then coordination among the information that is out there so that, we're sort of addressing any gaps that might exist, but it's really helping, marginalized communities get to their appointments. And we were able to show, for example, with our partnership with AHS, we were able to look at the no-show rates of certain vaccine clinics. And then through the work that we were doing in community, now it's, we can't determine whether that was a direct correlation, but through the navigation where we were providing navigation supports, we saw a change in the show rate of appointments. And so maximizing the resources and getting people to their appointments and making sure that that wasn't, wasted time for providers, for example.
Great, thank you, Deirdre. So reducing barriers is really important. Any other comments from, Jen, go ahead.
I'd say, you can see our acting CPHO has been out lately. You might have heard proactive things on CBC Morning I think Friday, just to really reinforce the National Advisory Committee on Immunizations advice, promoting the value of vaccination. Showing where we've had gains, countering all of the mis and disinformation, underscoring, the decisions in the US don't really impact Canada's vaccination recommendations, but I think showing where there's been benefit. I think there's proactive approach on targeting parents of young children coming up as well. So I think just that, again, back to basics of evidence data, showing where those gaps are.
Great, thank you, Jen. I think we're almost at time, but Madison and Martin, do any comment with reference to the last question? No? Okay. Well, I'd like to thank everybody for their time, and we really appreciate everybody's attendance or participation. And I would like to thank our presenters for their time and work in sharing their information and research. I'd also like to remind everybody to fill out the survey that will be sent out. We just want to ensure that these sessions are of value and that we can improve in any way. So thank you, everybody, for your time. We appreciate it, and we'll see you at our next session.